All right. Good morning. Thank you for all being here on bright and early. Um, we're going to have a fascinating panel today that's going to address an issue that's perplexed, I think, many of us as we hear about acts of extremism, mass violence, targeted shootings, targeted violence of all types, which is that distressingly we learn after the fact that someone knew something, right? And now hindsight is always 20/20, but there are people who, as we know in really a majority of lone actor terrorist cases, um, there's been leakage, right? There's been someone conveying information about what they were going to do. I first encountered this in my early work on workplace violence with the post office shooting in Royal Oaks, Michigan, where it turns out that the entire workforce knew that if the perpetrator, Thomas McIlvaine, lost at his grievance hearing, he'd already announced who he was going to come back and shoot in management, and no one said anything. We've seen this in workplace and school shootings where the kids say, hey, listen, you better not come to school tomorrow, or be careful, or don't go to the cafeteria. So this notion that people have knowledge of impending disaster, of impending violence, and no one does anything, that they are bystanders. It's particularly perplexing, and it's a particularly perplexing challenge when those bystanders are intimates. They're people who are friends, who are family, who are aware that their loved one, their friend, their community member is planning to cause great harm. And how do we get them to come forward, right? And how do we handle that information after it is revealed? So we have four of the world experts on the panel to talk about this today, and I'm going to just give a brief introduction for each of them in the order in which they're going to present, and they can tell us more about themselves and their research as they go. So Michelle Grossman is the Research Chair in Diversity and Community Resilience at the Alfred Deakin Institute at Deakin University in Victoria, Australia, and she is the convener of the AVERT enterprise, the Addressing Violent Extremism and Radicalization Network. Next, Paul Thomas, coming to us from the UK, is Professor of Youth and Policy in the School of Education and Professional Development at the University of Huddersfield. And David Eisenman is Professor in Residence at the David Geffen School of Medicine at the Fielding School of Public Health and the Fielding School of Public Health at UCLA. And he directs the Center for Public Health and Disaster. And finally, with me on stage here is Stephen Wein. He's Professor of Psychiatry at my alma mater, the University of Illinois College of Medicine at Chicago, where he's also Director of Global Medicine and Director of the Center for Global Health. And there's lots more about their phenomenal work and background in the bio, so I urge you to look at those. Michelle, tell us about your work in Australia and beyond, please.
Okay, thank you very much. It's an absolute pleasure to be with you today. And I'm going to kick things off by giving everybody a little bit of background on the work that we've been doing on intimate bystanders and community reporting. So the Community Reporting Thresholds Project began with a research grant from the Australian government in 2014. And it was really sparked by my reflection on an earlier study that we'd run here in Australia on community responses to radicalization and terrorism. So we knew that a number of terrorist plots had been disrupted in various countries, thanks to early warnings and tip-offs from those close to someone radicalizing or planning acts of violent extremism. But we realized that we didn't know anything about the actual experience of coming forward to authorities with such information or concerns. So what struggles, barriers, or conflicts about sharing information might people face, particularly if they're the intimate bystanders? So for example, the sibling, partner, child, parent, relative, or close friend of someone who's heading down this path. And how could we address these barriers and actually understand more about the needs of those who want to come forward and who might be amongst the first people to see or know something about what somebody is planning, but who also might hesitate to do so. So our combined evidence now across Australia, the United Kingdom, the United States, and Canada on why intimate bystanders come forward, when and how, who they're most likely to report to and the means that they'll use to do so, how intimate bystanders calculate and navigate the risks that they see in existing reporting channels, what structural and social resources can improve the likelihood of safe and confident reporting, and the role of confidentiality, anonymity, transparency, and empathy when reporting to law enforcement and other authorities. All of this coming out of our research has really changed the way that a range of policymakers and practitioners now think about how to facilitate improved community reporting on violent extremism. The Step Together program in New South Wales in Australia and the National Act Early program in the UK are two tangible information, support, and advice service outcomes from the research. And we're going to hear more about the Act Early program from Paul Thomas in a moment. So drawing on our methods and findings in 2015, where we had 33, it's a relatively modest study, 33 study participants in Australia. We've now repeated this research in the United Kingdom with 66 participants, in the USA with 144 participants, and most recently in Canada, we just finished that in March 2022, this year, with 180 participants. So each of these studies successively has grown the number of interview participants, the range of hypothetical scenarios that we've used to reflect changes in the ideological landscape of violent extremist motivation, and the inclusion of respondents from a very wide range of racial, ethnic, gender, cultural, and religious backgrounds. So in total, over 400 respondents from a broad swathe of local communities have been sampled through depth interviews in each country. And our funding, for which we're very grateful, right across these studies, has been provided respectively by the Australia-New Zealand Counterterrorism Committee, the United Kingdom's Centre for Research and Evidence on Security Threats, or CREST, the US National Institute of Justice, and Public Safety Canada. Now, I want to touch briefly on some of the convergent findings that we've developed across the 4 countries, so things that are pretty consistent, regardless of the local or the national setting. The first of these is that care and concern for a loved one and care and concern for community safety and well-being has been identified as the number one reason for coming forward across all countries. We've also found that reporting is a staged process. So a large majority of respondents would engage in various forms of information and or help-seeking behavior. So things like internet searching, consultation with friends and family, or direct intervention with the person of concern before they approach authorities as a last resort. Concern about the likelihood of violent action is the major threshold for willingness to come forward. But this is also coupled with a desire to source help to divert and support the person of concern. But there's also a very high level of concern for self-protection from reprisals or backlash if intimate bystanders do think that they're going to proceed with reporting. We found that trust in law enforcement for reporting is not strong in Australia, Canada, and the USA, but it is high in the UK amongst British Muslims. But interestingly, trust in law enforcement was not high for British whites. And we can talk about why that is perhaps during the Q&A. For communities where trust in law enforcement was low, trusted community brokers are often favored as reporting alternatives to law enforcement. And one of the really fascinating findings that emerged in Australia and has really carried through in a number of other countries is the strong preference for face-to-face reporting. This has to do with accountability and also risk navigation in how people perceive their dealings with authorities. But interestingly, phone reporting was just as likely to be selected as face-to-face reporting in the USA and Canada. Now, structural support before, during, and after reporting to help manage feelings of guilt, fear, and worry about consequences, unfortunately, is virtually non-existent. And this is a real structural and resource gap that we think needs to be addressed. There's quite a lot of confusion and indeed ignorance about who to report to, how to report, when to report, and about the impacts of reporting. And that confusion and ignorance is actually common not only amongst communities, but also amongst practitioners, again, right across the 4 countries that we've done the research in. Participants called strongly for greater transparency around reporting outcomes. Now, they understand the national security constraints, but they absolutely want to be kept in the loop as much as possible about the outcomes of their information sharing for their intimate. National security hotlines are absolutely appropriate for reporting imminent threats, but not for the kind of early intervention reporting that we focused on in these studies. So we've identified a real need for some circuit breaker reporting mechanisms, again, that can help address that gap. And finally, for those people out there who are thinking, well, you know, what could we do in the digital world to assist community reporting? Don't bother developing a smartphone reporting app. Nobody's going to use it. Digital footprints are a major concern for those who contemplate reporting, with very high levels of worry about traceability and discovery of their contact with authorities, which loops back to why people tend to prefer face-to-face and phone reporting. And with that brief summary of some of our key findings in common across the 4 countries, I'll now hand over to Paul Thomas.
All right. Thank you, Michelle. Paul, one moment, please, before you start. So I was remiss. If you have, everybody's been here for several days. You know the drill about the QR codes. Please, if you want to ask some questions to the panelists, take a picture of the QR code, and it'll connect you to send in the questions, and I'll get them up here, and we'll field them. All right. Thank you. Paul?
Yeah, thanks, Ron. Thanks, Michelle. Good morning to all the colleagues there in Pittsburgh, and greetings and good afternoon from myself in the north of England. It's good to be with you all. As Michelle's highlighted, our international series of community reporting threshold studies has focused on those community members possibly facing an intimate starting to engage with violent extremism. And our studies have consistently identified those intimate bystanders as wanting to engage in their own research, to attempt to understand what they're noticing, having no idea where to get such information, education, advice from, and how to access it, that they want to potentially be able to ask questions and seek reassurances from people with knowledge about their concerns, possibly on an anonymous basis, and that they're driven in this behaviour by the care and concern that Michelle identified for the intimate, wanting to identify help and support for that intimate in changing their thinking and behaviour before they go too far, before it's too late. And absolutely not seeing any anti-terrorism hotline as being seeing them as completely inappropriate for those needs. So that there's a very clear informational, educational gap there. Our UK study has directly informed a national UK policy and practice response, the Act Early campaign and website. And as you'll see, we're going to share a couple of images from the website. This is a counter-terrorism police-led resource, and that leadership is something we can talk more about in Q&A. It's a police-led resource aimed at potential intimate bystanders, and it's that I really want to use the time I've got available to briefly discuss with you today. So the national policy and practice response of Act Early was directly enabled by our UK research study and by Michelle's previous groundbreaking Australian study. And our UK study had an advisory group that included local government community engagement officers who work around racial tension, who work with community engagement, but also with counter-terrorism police practitioners. We subsequently shared our findings and their implications with national UK policymakers, and that's informed this campaign. So we carried out a series of in-depth briefings, both for the UK Government Home Office, which leads on counter-terrorism and crime prevention, but also for the national leadership of counter-terrorism police. And in the UK, counter-terrorism policing is led by the Metropolitan Police on a national basis. As the lead researchers for the UK study, Michelle and myself acted as official advisors on the design, tone and content of the subsequent Act Early campaign and the web resource. So the research studies have been very much influential in the way this is presented. So Act Early is upfront about being led by the police and about being linked to the UK's prevent strategy, which is, as colleagues may know, is controversial. And this does reflect the strong trust in and support for the police in the UK amongst British Muslims that Michelle identified. At the time of our research, ISIS-inspired extremism was the biggest threat to the UK, and that reflected the sampling that we engaged in terms of UK Muslims, although we did include a small sample of white British people. But it's important to say that Act Early addresses all forms of violent extremism threat. Act Early does, though, also identify how to contact non-law enforcement organisations such as Childline, who can offer advice and support on the issue an intimate bystander may be facing. So there are alternative routes to talking to the police personnel connected to Act Early. And can I have the next slide, please? So briefly, what does Act Early do? Well, it offers information and advice on understanding and spotting the signs of radicalisation, which we all know are complicated and not straightforward. It offers the real stories of families who have experienced radicalisation within their family or within their friendship group, and how they've been helped by the UK Prevent intervention of counselling and mentoring. And those are drawn from a variety of backgrounds, types of extremism. There's also guidance on how intimate bystanders can start conversations with family members, partners, or friends that they feel are heading towards extremist mindset and behaviour. It also explains the help and support, the mentoring and counselling that an intimate bystander's loved ones could receive through the Prevent strategist channel process if caught early enough. The Act Early has been promoted through parenting sites and organisations. It's been promoted through the education system and shared with communities and families in that way, as well as through community networks. And one of the things that British counterterrorism police has done is actually developed community advisory groups, both on a national level and on a regional basis, which again shows that really quite strong support for an engagement with communities, between communities and policing. So the UK police approach here, underpinning Act Early, is one of safeguarding, preventing potential harm in a way consistent with what has already happened in the UK education, health and welfare systems through the so-called Prevent duty to identify and refer cases of possible radicalisation. As colleagues may know, here the UK has taken the approach from 2015 onwards of a statutory duty for all frontline practitioners in education, health and social services to enact Prevent's reporting mechanisms, and that's been supported by national practitioner training. So referrals to Prevent and Channel have thus been coming from professional practitioners in education, health and welfare. But until Act Early, there was no mechanism for community members to share concerns about a loved one or a colleague and to safeguard their loved one in a preventative manner. And that's the role that Act Early is playing. So at that point, I'll hand over to David.
Okay, thank you. Thank you, Paul. First slide, please. All right. There we go. Good morning, everyone. Is my camera on?
Yes.
Yes, you're good.
Good.
Okay, good. So thank you for the invitation to talk with you today. The U.S. study is what I'm going to describe to you. The U.S. study is a little built on the work of Michelle and Paul by adding a really diverse sample reflecting the diversity of the United States. For instance, 15% of our participants were identified as Hispanic, 17% identified as Black or African American. But also coming from our public health and violence prevention perspective, we provided subjects with 3 scenarios. One was a non-ideological workplace targeted attack, and the other 2 were scenarios focused on ideology, one on a white supremacist, the other on an ISIS-inspired event. And it also added to the open-ended interviews a questionnaire with ranked preferences so that we could actually quantitate some of the preferences. I'll talk about that in a moment. And then we added some methodologically rigorous analytical methods. So some of the findings here, the staged approach, are shown on the slide here. But I want to emphasize that whatever I'm going to say here, we found that participants did not respond differently or perceive a different level of credibility based on the scenario. In other words, everything I'm about to say really holds true for workplace-inspired violence, workplace violence that's non-ideological and ideologically inspired attacks. So as Michelle mentioned, care and concern for both the potential perpetrator and the broader community is an immediate reaction. And stages begin with information seeking first. So first to the internet for most people, but also to friends and family. People are uncertain. They need to know if it's real, they say. They don't know the signs of targeted violence. They don't know if they're planning something really, and what is extremism? They don't even know what that word means. How can they change the perpetrator's mind? How can they help? What will happen if they do report to law enforcement? And how does reporting work? So community members want to confide in other intermediaries to get help and counsel without criminalizing or endangering the potential perpetrator. They will seek advice from a community-based person before they report to law enforcement. And this, of course, has the potential of delaying the prevention. So in our study, compared to talking with law enforcement first, the subjects preferred talking with mental health practitioners, and that was a statistically significant difference. Preferred talking to faith leaders, also statistically significant, and preferred talking to teachers, least among those three though, but more than talking to law enforcement. Now let's drill down on that mental health preference. When intimate bystanders view the potential for violence as a mental health concern, they will seek mental health practitioners to advise and guide them on whether and how to report. They believe that this mental health practitioner could provide counseling to the person at risk and make a formal report to law enforcement on the intimate bystander's behalf, if necessary. But unfortunately, study members said accessing mental health services is difficult. And as all Americans know, this is true, right? We have a spotty, mostly hole-filled insurance system in the United States. Subjects noted high out-of-pocket costs for mental health care. Subjects noted a shortage in rural and ex-urban communities of mental health practitioners. And they all recognized that connecting the person at risk with a mental health support may be difficult, especially if the person does not consent to treatment. Now, many viewed reporting directly to law enforcement as a last resort, especially whenever the potential perpetrator is a family member or friend, as opposed to a coworker. In those cases, intimate bystanders prefer to seek help from mental health or other community professionals, like social workers or faith-based leaders. The intimate bystanders in our study frequently feared involving law enforcement because of the possibility of harming the potential perpetrator. They expected law enforcement to respond more harshly to a person who is a racial minority, including the potential for injury or death from police violence. And because of direct or indirect experiences and hearing about local law enforcement violence and racial discrimination, intimate bystanders hesitate to ask law enforcement for help, fearing similar treatment. As one person said, "It would make me feel very afraid because I personally do not trust law enforcement or authorities, only because of my own personal experiences and my community's personal experiences with law enforcement. It's not a safe relationship." This concern was not limited to minoritized communities either. Intimate bystanders who identified as white feared this response if the perpetrator was non-white. They particularly fear harm to someone with a mental health problem. As one subject said, sometimes people who are going through mental health episodes, they end up getting hurt or sometimes killed just because police aren't properly trained always to de-escalate those situations. A few subjects who responded to the white supremacist scenario noted that they would have some concern reporting a white supremacist to local police because of the possibility that members of the police may be involved in or sympathetic to those ideologies. Nevertheless, it's still important to note that subjects throughout the study said they would report in the end, that the potential benefits outweigh the potential harms, despite concerns about police violence and racial discrimination across groups of demographic groups, they would report in the end. Next slide. Finally, in the United States, we would say that there is value in a mixture of ways to report. Yes, reporting by telephone and in person were strongly preferred to website and app, but let's put some numbers to this. The telephone was the most popular option, 56% ranked as their first choice and 21% as their second choice. So 77% preferred the telephone. In-person reporting was the second most preferred method, 54% first choice, 17% second choice. So 71% preferred as their first or second choice. And this is, with the telephone because it's perceived as fast and facilitating in anonymity, and in person because it's perceived as people are able to see the live reaction of the person they're reporting to. They're able to gauge if they're being taken seriously, and they're able to give the nuance of the story. But still, in the end, 40% ranked website or app as a first or second choice. So that's still a healthy minority of people in the United States who would prefer some sort of website or app. These people cited their ease of access in reporting and facilitation of anonymity and confidentiality. Participants feared that a report submitted via smartphone or email or app might go unanswered by law enforcement. So there is that concern. And moreover, apps and websites may have character or content limitations, preventing one from talking about it in detail or sharing as much as the reporter feels comfortable with sharing. But we find in the end that a mixture of the ways to report will be important. Thank you. I'm going to turn it over to Steve to talk about the implications of our study.
That's great. Thanks, David.
Okay, so this research says that we really need to do more to teach community members, community-based practitioners, probably law enforcement too, about reporting. And we've heard about some of the successful efforts to do so in other countries, such as Act Early, which Paul talked about. For that reason, we applaud a new initiative that we recently learned about, Screen Hate, from the McCain Institute, which is a new digital hub which really focuses on especially young people's potential involvement in online hate, encourages parents and other caregivers to be aware. They break it into 4 steps: prepare, talk, prevent, seek help. And I especially like the talk part. It gives them, like kind of Paul said, for Act Early, talking points, how to start that conversation with your, say, your son or daughter. This is a kind of practical, very useful help that people need. If someone was going on the internet and found that, a parent was going on the internet and found it would be very helpful. I'm thinking in particular of parents that I've recently spoken with who are involved in cases such as this. And that advice would be super, super helpful. I'm concerned that such intimates as a parent are just surrounded by a kind of drumbeat of fear. They have so many fears in that situation. They, of course, afraid of what their loved one might do, but they tend to be even more afraid of what harm they might bring upon their loved one if they call the police, if the people in if their neighbors find out about this, if it ends up in the media. And there's been a lot of cases. I'm involved in casework, so this is not abstract or conceptual. I see this happening all the time. And so that's the kind of ecosystem within which we have to think about interventions to improve communication, education, public information. And I think that we have to say that we know a lot from the research that David, Paul, and Michelle have described very nicely. We know a lot about people's thinking and behavior regarding like these scenarios, but we don't really know enough about how to necessarily change their thinking and behavior through some kind of public messaging. That's kind of a whole different ball of wax, isn't it? When we think about intervention, that's a whole different kind of research. So, and they're not just academic questions. I think governments and communities need to really reflect upon what, whether the messaging campaign or public information site that they're going to provide is really going to be effective. So let's just think about a few different aspects of that for a minute. Our research, I think in general, showed that there were two kinds of areas where there were big gaps. One is lack of information about how to report, or about reporting in general. And the other was fear of negative consequences about reporting. And so it makes sense that a mitigation strategy, through some kind of public communication campaign or whatnot, would try to address both of those. So it needs to explain to people what is extremism and hate. It needs to explain to people what are the potential indicators. It needs to explain how and where to report and how the reporting process works. But it also needs to address the fear of negative consequences of reporting. So it needs to strongly emphasize that there's no safety without inclusion. It needs to emphasize that the government or law enforcement has expertise in helping people to leave extremism and violence. It needs to emphasize if you act early, we can help, which the Act Early program sends, in the very title of its program, it's sending that message. And it needs to emphasize that family and friends can seek help and get support. Because remember that oftentimes these situations bring up a lot of conflict within family if you have one family member reporting on another. So you need some kind of counseling to deal with the fallout of all of that. Yeah, so these are the issues that we think would need to be addressed. These are, in effect, hypotheses that need to be examined if from a kind of risk communication point of view. We, in our thinking about this, we're also influenced by some theoretical paradigms which say that reporting will be driven by what has been called response efficacy. Means the person needs to expect that responding in this way is going to effectively deal with the problem. Also, self-efficacy, that the person needs to believe that they have the ability to successfully carry out what's being recommended to them. And then also response cost, the cost that one attaches to the recommended response. So in this case, people are very concerned about response cost, that if I talk to other people about this, I'm going to bring on more damage than I would by not doing anything. And then they're concerned that they don't have the ability to do it. They don't know what they're being asked to do. So I think that the kinds of the strategies of providing information and building trust should help in those regard, but we don't really know. So in the end, I think that we need to be implementing strategies like screen hate and other kinds of tools, especially in the digital realm, but across the board, as David said, giving people in communities different kinds of options. But we also need to be examining those to see which are going to end up being the most helpful to folks in the community, just like we do in other areas of risk communication, whether it's smoking cessation or encouraging people not to use drugs or change their health behavior or disaster response. We need to examine what's the most helpful and then make adjustments to strengthen those messaging. Thanks.
Thanks, Steve. So we've had some great questions coming in just for the entire panel. Anybody can answer this, and all of you can answer it. Is there any data around whether or not intimate bystanders confront their relation before reporting?
We've had, there has, in quite a few of the responses in different countries, quite a large number of respondents said that they would try to talk to their intimate first. Yeah. So I don't know that I would use the word confrontation. I'm not sure that that's quite the right characterization. But they, many people said, I would talk to him or her, depending on which scenario we used. I would try to see how serious they were about what they were talking about. They might try to challenge some of their thinking. So there was certainly that sense that if they already had a good, close, trusting friendship or relationship, whether it was a family member or a friend, that yes, many of them would try to have that conversation first. And as much to assess how serious the threat being posed was, but also to sort of see how much trouble the person of concern might be in, from a mental health perspective, or otherwise.
I'd also add that across all our studies, some respondents gave parallel examples from their own life where there had been a different sort of social harm developing amongst an intimate, and they had confronted it and attempted to address it.
Okay. Anything different from the U.S.?
No, we saw the same results. Steve, do you know of any data, though, that's actually looked at cases or series of cases and retrospectively looked at the number, the percentage that have spoken to the perpetrator, the potential perpetrator? We do know that leakage happens, of course, very high percentage, but how often has that been followed by actual confrontation? I don't know
the number, but I think it's high.
I don't know that there are studies of that. I haven't seen them if there are. So I'd be interested to see those.
Paul Gill's sort of study of lone actors showed that at least there was a significant leakage from a lot of those lone actors, and at least a proportion there'd be some sense of confrontation with people close to them.
But can I just say, these are not easy conversations to have. Mm-hmm. It takes a certain amount of courage, I think, to be able to, to say that. it's a difficult dialogue, and I think part of the experience of people who know somebody who is on a pathway to radicalized violence often feel a bit helpless or unprepared. They don't even know what to say. Yeah, other than to have that sort of initial engagement, but it's a daunting experience. I think that's how I would characterize it, and that certainly came through from participants in our studies.
And what I learned from our studies and also from real world cases is that when the experience is online, people don't see what their friend or loved one is doing. It's not tangible. They just don't know. And so, and there's a lot of opportunity for deception. And that really increases the sense of helplessness. And I agree with Michelle, it's much less about confrontation, more about just trying to understand.
Yeah, thanks, Steve. Does your research incorporate failed interventions or situations in which the intimate decides not to report and disaster follows? Because that's the sample I see in my forensic work.
Yeah, that's a very interesting question. And the answer is we were prepared to find a proportion of people who would report and then a proportion who wouldn't. I have to tell you that with very, very few exceptions, as in count on one hand, out of over 400 people, the willingness ultimately to report is phenomenally high. And the reason for that comes through really, really clearly in all the data is that, when people are imagining, because we ask the question, what would happen if you didn't report and how would you feel if you didn't report, knowing what you know from the scenario. And the almost universal answer was that people said they didn't feel that they could live with themselves if they didn't share that information and then something terrible happened. So, there was what you might call an ethical imperative or a moral imperative, where in the calculations that people do, worried about the person of concern, but that concern for the whole community, for the safety of community, for the safety of society, and the burden of guilt that they imagined they would feel if they said nothing and then something horrible happened, was enough to motivate people to say, ultimately, I would come forward.
Got it. Thank you. So here's a question that was directed to David, but I think anyone can participate in this. It seems to me it arises out of some of the work that Williams and Horgan did, and there was somebody else on that paper looking at kids who said, "Oh yeah, I would report," in a training session, and then actually in confidential reporting said, "Yeah, there's no way I would report because of all these other concerns." So here's the question, David. In scenarios, people said they would definitely report. Going to your comment, Michelle. Do you think this is true, or do you think that once people are actually in the situation, they would rationalize the reasons away for reporting?
Well, certainly let's see. On the one hand, it's fascinating that across 4 countries and over 400 participants, we have this, and over, almost 10 years of research and multiple types of ideologies and cross diverse cultures and so on, the findings are so consistent. So if people's cognitive biases are strong, they're incredibly strong if that's the case. So I do have some confidence in the findings. Is it single digits in the end empirically? That's a question we need to know. I mean, yes, it may be the strength of the findings may be worthy of this kind of question, but I don't think the direction of the findings will change. I think we will still find that the majority are so motivated by care for the intimate and concern for the community moral concern as well as, personal concern that they'll do something, they'll seek help. But yeah, there might be higher numbers than just single digits in the end.
I'd make a couple of comments. Sorry, Michelle. I mean, one is that Mick Williams and colleagues' work did show originally in the first sort of tranche that the closer the relationship, there might be a greater barrier to reporting. But as their studies developed, they had a very consistent finding with their own that people would report out of that care and concern. I guess the other comment I'd make from working closely with the UK police authorities was that they said that intimates do report previously, but they report only at a very late stage when someone is already committing the criminal act or is traveling to a conflict zone or has prepared a device. Now, I guess the question is that are people not reporting before that because of the reasons you indicated, Ron, or is it actually that people don't know how to, they don't know what they're seeing, they don't understand what they're seeing, which is all that educational, informational sort of a gap that our studies are identifying.
Yeah,
I just want to add a very quick comment here, which is that all of this goes to the question of how safe these reporting processes are for people to engage in. So, unsafe reporting processes, unsafe reporting mechanisms are going to be decisive in people who think, well, yes, I would report, but when it comes to it, in reality, and the process is not safe for them, that they are then, of course, gonna find ways not to do it. So I think for me, this really exposes, goes back to some of what Steve was talking about in terms of the implication. How do we make reporting a safe process that people can actually feel confident in?
And the trends, that you described in all 4 countries are very reassuring in terms of our efforts here at the summit and going forward of educating the public, educating the media, educating government about building a system that attends to the cost that Steve was talking about, which sets us up very nicely for the next question. What is the fear that reporting an individual will put them into the system? And once this occurs, the course and outcome are set. What can be done to resolve this fear or prevent a fait accompli?
Yeah, that's we agree with that concern. And I think that one really important step along the way there would be to demonstrate that municipalities, states, federal agencies have the capacity and the intention to find, alternative remedies than just locking people up or setting them up for stings or things like that. I think that people need to see that there's a fairness in the system, and there are signs of that. But I think that overall, in the U.S. at least, the punitive nature of our system is more prevalent and more known than our other aspects. But I think that's changing, or at least I'm hoping that's changing. I just want to go back to one other thing, that our research really focused on adults. And I think we have to realize that we don't necessarily know all that much about how adolescents would respond. Adolescents are going to be much more influenced by peers and by concerns that they're deviating from their peers, and so would be much less likely to report, one would imagine. So there's a whole set of different kinds of initiatives that schools have put in place to try to encourage adolescents to have a safe place to report. But I just want to put that out there, that we need to think about the adolescent group is not necessarily the same as our studies showed for adults.
Yeah, it raises an interesting question there, Steve, about whether some of the intermediaries that we've identified and across our cohorts in these countries, for example, schools, school counselors. I know teachers were not popular, in the U.S., but they actually emerged as more trusted figures in the Canadian data. for example, and I think in the UK data as well. So, you know, one piece of the next bit of research that we might think about, you know, needing to do is, you know, if young people are not so confident about going directly to authorities, are there community-based systems that they would feel you know, more comfortable, you know, with and feel are less risky? And it's a really, really important question because of some of what we're seeing in terms of some of the risk scenarios that are developing even as we speak. Yeah.
Thank you, Michelle. I'm sorry to say this, but the clock has turned red. And we have several great questions. I would encourage you to chat with the panelists, like one's in Australia and one's in the UK and one's in California. So all questions go to Steve after the session. I'm sure he can answer them, but there are some great questions about things going forward. Thank you to the panelists. Thank you all being here. Please join me in a round of applause for our experts.
Thank you so much for having us.
Thanks, guys.
Bye.
Thank you.
See you later.
Bye.
Bye, everybody.